Have you ever wondered if a decision made in one chapter of your life could quietly rewrite the chapters that come after it? For millions of women around the world, this question lingers in the back of their minds long after a medical procedure is over. Can a single abortion change your ability to carry a healthy pregnancy years later? Will it affect your fertility, your baby's safety, or your own body in ways doctors don't always talk about? Today, we're diving deep into one of the most searched, most misunderstood, and most emotionally charged topics in reproductive health. We're going to separate fear from fact, myth from medicine, and give you the kind of clear, evidence-based answers that every woman deserves to have. By the end of this video, you'll understand exactly what decades of research say about abortion and future pregnancies, and just as importantly, what it doesn't say. So if you've ever lain awake wondering, did that decision change my future? Stay with us, because the answer might surprise you. Before we can talk about long-term effects, we need to understand what we're actually talking about because not all abortions are the same, and that distinction matters more than most people realize. There are two broad categories of abortion procedures used today. The first is medical abortion, sometimes called the abortion pill, which involves a combination of two medications, mifepristone and misoprostol, that work together to end an early pregnancy and cause the body to expel the pregnancy tissue, much like a heavy, managed miscarriage. This method is typically used in the earlier weeks of pregnancy and does not involve any surgical instruments entering the uterus. The second category is surgical abortion, which includes procedures like vacuum aspiration, dilation, and curettage, commonly known as D&C and dilation and evacuation, or D&E, which is typically used later in pregnancy. These procedures involve a healthcare provider using instruments to remove pregnancy tissue from the uterus, and they require the cervix to be gently dilated or opened to allow access. Here's something that might surprise you. The gestational age at which an abortion occurs and the specific technique used can influence how the body responds afterward, and this is where the story of future pregnancy effects really begins. So now that you understand the basic mechanics, let's get into the question everyone's really asking. Does any of this actually affect your ability to have children later? This is the part of the video where we need to slow down because this is where the myths and the medicine often collide. Let's start with the big one. Does abortion cause infertility? According to large-scale studies conducted across multiple countries, including a major Finnish registry study that tracked over 57,000 first-time mothers, researchers found something quite reassuring. Women who had a prior abortion were significantly less likely to require treatment for infertility compared to women without a prior abortion, which strongly suggests there is no meaningful link between having an abortion and developing secondary infertility. Let that sink in for a moment. The fear that one abortion will permanently damage your fertility is, for the vast majority of women, simply not supported by the data. Another large nationwide study looked specifically at how many women needed IVF treatment after having an abortion. The results? Only about 0.4% of women in the entire study group required IVF treatment after an induced abortion. And when researchers dug into who those women were, they tended to be older, of higher socioeconomic status, and had fewer previous abortions or deliveries, meaning the factors linked to needing IVF were the same general risk factors for infertility that exist in any population, regardless of abortion history. In other words, age and other personal health factors were the real drivers, not the abortion itself. The researchers even concluded directly that abortion-related outcomes are not associated with an increased need for future IVF treatment. But, and this is important, for most women doesn't mean for every woman in every situation. There are rare but real complications that can affect fertility, and understanding them empowers you rather than scares you. One of these is called Asherman's syndrome, a condition where scar tissue forms inside the uterine walls, essentially creating internal adhesions that can interfere with the uterine lining's ability to support a pregnancy. This is a disorder that can sometimes occur after a surgical procedure such as a D&C, though it remains relatively uncommon. Another rare risk involves infection. If a pelvic infection develops after a procedure and isn't treated promptly, it can potentially affect the fallopian tubes or uterine lining. Which is why, while there's generally no evidence that a complication-free abortion increases future fertility risks, an untreated infection is one of the few situations where risk can increase. So here's the question that naturally follows. If fertility itself usually isn't the issue, what about the actual pregnancies that come afterward? Does having had an abortion change how a future pregnancy unfolds, the risk of preterm birth, placenta complications, or miscarriage? This is where the research gets more nuanced and honestly more interesting. Let's break it down piece by piece. First, let's talk about preterm birth, babies born before 37 weeks. This is one of the areas where researchers have found some signal, but the picture is far from simple. A landmark study from Scotland, which tracked national abortion and birth registry data, found that while initial research after abortion was legalized in 1967 showed no increased risk of miscarriage or preterm delivery from a single abortion, the picture changes when you look at repeat procedures. Specifically, the available literature suggests that the risk of preterm delivery increases with multiple abortions, not necessarily from a single procedure, but from the cumulative effect of repeated surgical interventions on the cervix over time. Why would this happen? Here's the medical explanation. Every time the cervix is dilated for a surgical procedure, there's a small amount of mechanical stress placed on the cervical tissue. For most women, this heals completely with no lasting effect. But with repeated dilations, especially multiple D and C or D and E procedures, there's a theoretical concern that the cervix could become slightly weakened over time, a condition sometimes called cervical insufficiency, which in rare cases can contribute to the cervix opening too early in a future pregnancy. The Scottish researchers were careful to note something crucial here too, because they couldn't fully adjust for gestational age at the time of abortion. They couldn't rule out the possibility that surgical procedures performed later in pregnancy, which require more cervical dilation, might be the real factor driving any increased preterm birth risk rather than the abortion itself. This is a perfect example of why we have to be careful with cause and effect in medical research. Correlation isn't always causation. Now let's talk about something a lot of women have never even heard of: placenta-related conditions like placenta previa, where the placenta partially or fully covers the cervix, and placenta accreta, where the placenta grows too deeply into the uterine wall. The theory here connects back to the uterine lining. If previous procedures have caused any thinning or scarring of the endometrium, the lining of the uterus, a future placenta might implant in an unusual location or attach more deeply than normal as it searches for a healthy area to anchor itself. It's a bit like how a plant's roots will grow toward the most fertile soil available. That said, for women who have had a single, uncomplicated abortion with no infection and no scarring, this risk remains low. And what about miscarriage? Arguably the fear that weighs most heavily on women's minds. Here's where the data becomes genuinely reassuring. Looking across the body of research, including the major U.S. studies examined by national health committees, researchers comparing women who had previously undergone abortion procedures with those who had not found data that overall does not point to a consistent increased risk of major pregnancy complications tied to a prior abortion. One widely cited summary puts it simply: there is no evidence to support that having had a complication-free abortion in the past leads to an increased risk of spontaneous abortion, meaning miscarriage, ectopic pregnancy, preterm birth, or low birth weight in a future pregnancy. So if the overall picture is this reassuring, why do so many women still feel anxious? And more importantly, what factors actually do tip the scales toward higher risk? Let's find out, because this next section might be the most practically useful part of the entire video. Not all situations carry equal risk, and understanding the factors that matter most can help you make informed decisions and have better conversations with your doctor. The first factor is the number of prior procedures. As we discussed, single abortions show minimal long-term impact in most studies, but the data on repeat abortions, particularly multiple surgical procedures, shows a more noticeable, though still relatively small, increase in certain risks like preterm birth. This doesn't mean multiple abortions guarantee a problem. It means the statistical signal becomes more visible the more times a procedure is repeated. The second factor is procedure type. Medical abortion, since it doesn't involve instruments entering the uterus, carries essentially no risk of the mechanical complications we've discussed, like cervical trauma or Asherman syndrome. Surgical procedures, while still very safe overall, carry the rare risks we've outlined, which is why understanding your options and discussing them with a provider matters. The third factor is gestational age at the time of the procedure. Later gestation procedures typically require more cervical dilation, which, as we discussed, may carry a slightly higher theoretical risk for future cervical-related complications compared to very early procedures. The fourth factor, and honestly one of the most important, is provider experience and clinic standards. Here's a statistic that might genuinely shock you. According to multiple studies, legally performed abortions carry a lower risk of negative outcomes than vaginal childbirth or a C-section. In fact, The risk of death from childbirth is 14 times higher than the risk of death from a legal abortion. Read that again. The procedure many people fear as inherently dangerous is, statistically, significantly safer than giving birth. But, and this is critical, that safety profile depends heavily on the procedure being performed by a qualified provider in a properly equipped, licensed facility with appropriate follow-up care. And the fifth factor is your own pre-existing reproductive health. Conditions like endometriosis, fibroids, or a history of pelvic infections unrelated to abortion can independently affect future fertility and pregnancy outcomes, and these factors exist completely separate from any abortion history. Now, let's do something I think you'll find genuinely useful. Let's go through some of the most common myths about abortion and future pregnancy and bust them one by one with what the actual evidence shows. Myth number one, having an abortion will make it much harder or impossible to get pregnant again. Fact, as we've already covered. Medical guidance reflects what long-term studies consistently show. Abortion does not make it harder to get pregnant in the future, and does not increase the risk of infertility whether the abortion was medication-based or procedural, as long as care was provided safely and without delay. Myth number two, one abortion will permanently damage your uterus and ruin all future pregnancies. Fact, for a single uncomplicated procedure, the uterine lining heals and regenerates in the following weeks, much like it does after a natural miscarriage or even after childbirth. The endometrium is remarkably resilient tissue. Myth number three, medical abortion is always the safer choice for future fertility compared to surgical abortion. Fact, while medical abortion avoids instrument-related risks entirely, surgical abortion, when performed properly, also carries very low complication rates. The right choice often depends on gestational age, personal health history, and individual preference, not a blanket fertility safety hierarchy. Myth number four, and this one genuinely surprises people, you can't get pregnant again right away after an abortion. Fact, ovulation can return very quickly after an abortion, sometimes even before your next period arrives. This means that without contraception, pregnancy can occur almost immediately afterward, which is exactly why discussing contraception with your provider during or right after your procedure is so important. Myth number five, most studies on this topic are biased or unreliable. Fact, the research we've discussed today comes from large, population-based registry studies, some tracking tens of thousands of women over multiple years, using objective medical records rather than self-reported surveys, which gives this data a high degree of reliability. Now that we've cleared up the myths, let's talk about something practical. What can you actually do to protect your reproductive health, whether you've had an abortion in the past or are simply trying to be proactive about your future fertility? First, follow-up care matters enormously. If you've had an abortion, attending your follow-up appointment allows your provider to confirm the procedure was complete and that there are no signs of retained tissue or infection, the very complications most linked to rare long-term effects. Second, know the warning signs. Heavy bleeding that soaks through more than one pad per hour for several hours, fever, severe abdominal pain, or unusual discharge with a strong odor in the days following a procedure should prompt immediate medical attention. Catching and treating an infection early is one of the single most effective ways to prevent the rare complications we discussed earlier. Third, if you're planning a future pregnancy, consider preconception counseling with your OB/GYN, especially if you've had multiple prior procedures. This gives your doctor a chance to review your full reproductive history and monitor for any cervical or uterine factors that might benefit from extra attention during a future pregnancy. Fourth, focus on the fundamentals of reproductive health regardless of your history, taking a folic acid supplement before conception, staying hydrated, maintaining a balanced diet rich in iron and protein, avoiding smoking, and managing chronic conditions like diabetes or high blood pressure. These factors have a far larger, well-documented impact on pregnancy outcomes than abortion history does for the overwhelming majority of women. And finally, if you do have concerns, whether about a past procedure, irregular cycles afterward, or difficulty conceiving, don't sit with that worry alone. A reproductive endocrinologist or fertility specialist can run targeted tests, and in most cases, can provide real reassurance based on your specific situation rather than statistics alone. So after all of this, what's the real takeaway? For the vast majority of women, a single, properly performed abortion, whether medical or surgical, does not significantly increase the risk of infertility, miscarriage, or major pregnancy complications down the road. The body's ability to heal and regenerate is remarkable. Where research does show small increases in certain risks, like preterm birth, Those risks tend to be associated with multiple repeat procedures, later gestational ages, or complications like infection, not with the simple fact of having had an abortion at all. Knowledge isn't just power here, it's peace of mind. Whatever your past, whatever your future plans, understanding the real evidence means you can make informed choices, ask the right questions, and approach your reproductive health with confidence rather than fear. If this video helped answer questions you've been carrying for a long time, you're not alone, and now you're better informed than ever.